Welcome to the girls. As always, we have a very special show for you today. And Janine, while I was getting ready today, I decided to go out and take a picture of the beautiful cherry blossom tree in front of my house. Well, actually apple blossom, because we hardly ever get to see it. And I got stung by something. I don't know if it was a bee or if it was a mosquito bite. So
Always
I didn't
something.
know right away till I went in the house. I started getting ready. And this knuckle just started swelling up, and then it was the itch. You know, when you get the itch. It's like, okay, Facebook. Went on, posted the question, what is the best remedy to stop the itch of a mosquito bite? Wait to hear some of the solutions.
Oh, boy.
Thank you guys, by the way. Beer. So I said, well, do you drink it or do you put it on?
Both would be my answer.
How about mud? Okay, did you ever use that? Benadryl, which I didn't want to take because I had the show to do. Baking soda and vinegar. Tea tree oil. Spit. How about spit in the palm of your hand?
Was pee on it on there or no?
With some salt.
Just wondering, because
Then
that's what
rub
they
it.
say for stings.
Oh yeah, for pee. Witch hazel, which I probably would have used, but I didn't have any. Vinegar.
Dad could have peed on it. There you go.
Let's see, Dad
Problem
wasn't
solved.
home. Toothpaste. So I thought, wait. I was in the bathroom getting ready, how to brush my teeth. So before I brushed my teeth, I took the toothpaste, dabbed it on there, nice little gel toothpaste, and boom, I let it go, and I forgot about it, and it worked.
Well, speaking of toothpaste, we're going to be talking about teeth today and the health of your teeth and what your teeth can actually tell about the rest of the health in your body. We're here at Dr. Loren Grossman's office in Kingston, Pennsylvania, and we have a really good show, an educational show. We have a patient on with us. So if you have problems with your teeth or you haven't been to the dentist, we're going to tell you why you should be coming here, not only for vanity reasons, but for health reasons as well. And also, all of our friends who say they don't see us on cable, but they like to because people watch us in Florida and New York and all kinds of places.
All over the world.
You can see us now on a free app. It's the Samsung Productions app. Just download it on any device, and you can watch all of our shows, including the girls.
Okay, easy peasy. So we're going to go get Dr. Grossman, and we'll be right back. Stay with us.
Welcome back. We're in Kingston, Pennsylvania on The Girls, and today we're talking about teeth and a healthy smile. We're here with Dr. Loren Grossman, and we're glad to be in your office, so thanks for having us.
Well, thank you.
It's not the first time we've met because
No.
I came here before with these pearly whites. I came to you after meeting Carol Zubris, a mutual friend of ours, and she referred me to you to get a brighter smile, and we did the Zoom.
Right.
And that went perfectly, as you can see.
Well, I hope so.
So we're here today talking about teeth and a healthier smile.
Well, I just had a tour of your beautiful office, and you could get some of the surroundings where we're sitting. It's beautifully decorated. And you were a burst of spring when we came in. I just see the beautiful shirt that you have on. But
Well, thank
not
you.
only are you bright like that, but you made us feel so comfortable and so welcome. And you gave us the tour of your dental office here. And you have quite a place here. I mean, you have everything
thank you very
from...
much.
It's really, really beautiful.
We work hard at making sure that facility also matches the work that we do, and and my shirts, of course, have to
Yeah,
match.
absolutely.
And my watch.
Well, you know what they say, you're never fully dressed without a smile. So you've been supplying smiles for how long now? How
For
long?
about 34 years.
Oh, so you
here
know a little
in-
bit of what you're doing.
I hope so, but it's been a road well traveled, but yet we work hard at it.
All right,
And I'm surrounded by a great staff.
Well, in addition to dental work, which people come for you for fillings and all of the regular dental things that people think about, what are some of the specialty things that you do to provide a beautiful smile?
Well, we certainly offer certain cosmetic and aesthetic procedures. One which is veneers, which are thin ceramic coverings of teeth to alter shape, color, and enhance someone's beautiful smile.
So instead of having braces, you could have maybe those put on to change how your teeth look?
You can. That is one method. Another cosmetic procedure is crowns, but now we don't even use metal anymore, and our crowns are mostly all ceramic. And the materials over the last 10 to 15 years have changed dramatically. They're lifelike, they're translucent, and they really do make a difference in a person's, demeanor and how they feel about themselves.
So in this day and age, if you want a beautiful smile, there's something for everyone, I guess.
Right, and it builds up their sense of self-worth.
So talk about how people at home could take care of their teeth from a young age. What are some of the steps they could take? Some tips that you can offer?
Well, certainly, when you have children, you want to start them off early enough so they feel comfortable, and yet you can develop a trust with your young patients. And usually we recommend anywhere from 18 months to 24 months to start off at the dentist. And usually studies do show that if you start off that young, before age 2 or even age 2 or 3, that usually those patients develop without any cavities in their teeth because they're used to going to the dentist at such an early age and being treated in the office and fluoridated. And usually when you're checking them early on, you make sure you follow them throughout their teens, their preteens, teens, and into adulthood. And hopefully they'll develop a program where they're coming every 3-6 months for their hygiene appointments.
So how often should they be going to the dentist, and how important is it for people to be flossing or using mouthwash and that kind of thing?
Well, you want to, they should be going every 6 months at least, and they should have fluoride treatments up to age 16, and even adults should have fluoride treatments, but the problem with that is insurance sometimes only pays up to a certain age. And they should be checked at their preteen years for possible orthodontics and wisdom teeth problems to keep their teeth healthy, because those are the main issues in younger children that see the dentist at an early age.
Okay, so if I know, like in January, I always think, I got to schedule all my appointments, go to the dentist, and sometimes we put that off, but it's really important to get those cleanings, especially as an adult.
Oh, it's so important because you can prevent problems or have them, making sure something down the road doesn't occur, and if it does, it minimizes the issues that would come from that.
Gotcha.
A lot of people cringe when they hear the word dentist because they associate it with a drill, pain. Even sometimes if you have the nerve exposed, you have that little bit of shot of air. So what are some of the comfortable ways that you can tell us about how your patients enjoy coming here?
Well, our office is versed in, certainly we pride ourselves in our communicative skills, just like you do, and you're so good at it. But, and you guys should give us a lesson in that too. But, first of all, our environment is important. Right. How you talk to people is very important. How they feel about themselves. And you have to take the time and invest in that individual, not only from their oral health, but their whole body and their whole healthy outlook. And you have to make sure that the chair is comfortable. We use certain topical anesthetics before they even have to be anesthetized to do any work. We make sure a lot of times, just developing a trust, developing a relationship early on is important for their comfort so that they can feel better about coming to a dentist and having treatment done.
Yeah, because I think that's one of the most important things. People put off going to the dentist because sometimes they have that fear of pain, especially guys, hint, hint, my husband. And a lot of guys just say, I don't need it. And then they say, well, it's too late now. I'm too old for that. Is it ever too late to go to the dentist?
No, it's never too late. And it's never too late to do orthodontics, bridges, implants. It's a fallacy. I mean, we'll do implants and cosmetic procedures on 80-year-olds. It's never too late.
Well, you mentioned before about how oral health has to do with your entire body. So there's a lot of things you check for as well.
Oh yeah, your mouth is a gateway to your general health. I mean, there's a relationship between diabetes and your oral health, and there's a relationship between heart disease and teeth and gums and supporting structures of your mouth. Inflammation is the key player in any health concerns, and if you have less inflammation in your mouth, there's less inflammation in your body. So there is quite a relationship. So not only are we treating teeth, we're treating the whole body. We're making sure that if there's any problems we see, counseling that patient to further their appointments with their physician.
And I'm sure you do the oral examination for cancer.
Right, that's the key. We do make sure that we do an oral cancer exam on everybody after 18. And let me tell you, there is an increase in oral cancer, and people assume oral cancer, not to get off on a tangent, but it has to do with alcoholism or smoking. Let me tell you, the third type of oral cancer is caused by the HPV virus. And it's important that everybody young gets an oral cancer exam, even if there's no history of of alcoholism or smoking, because that type of cancer is on the upswing.
Now, I know when I came in, we were talking about making someone feel comfortable, and a big part of your staff is they thoroughly explain everything that's going to happen. Because I was a little hesitant. I heard, oh, is it going to hurt? But your staff took me through the steps of what was going to take place, what they were going to do, what was going to happen, and they were honest about each step. So that really put me at ease. So explaining the process of what the patient is going to get before they get it actually is very comforting.
It's very important to, like I say, or like you said, making sure that the patient's well informed of what's treatment you're doing, after the treatment, before the treatment, and making them feel comfortable with everything.
Very good. Well, we have a patient of yours with us today that's going to talk when we come back here on The Girls, and you're going to hear a little bit of a testimonial from her, right from the patient's mouth. We're going to talk with one of your patients here when we come back again. We are talking about a healthy smile here on The Girls. We're in Kingston, Pennsylvania. Remember, if you didn't do so already, you could download our Samson Productions app for free, and you can see us anywhere. If you don't get us on cable, those areas that don't get us on cable, you can see us on the app on any device, and you can watch us on SSP TV or ssptv.com. We'll be right back. Welcome back, everyone. You're watching The Girls. We're on location today in Kingston, Pennsylvania, and we're here at Dr. Loren Grossman's office. We're talking about your teeth and, most importantly, keeping that smile healthy. And we have one of Doctor's patients with us now to talk about what she had done. When I was here getting my treatment done, I actually kind of ripped her off the chair and said, hey, we're going to have you come on and do a testimonial with us. She's like, all right. So thank you so much. You were a good sport about it, Amber. So thanks for being on the show with my mom and I. And tell us about how you got to know Dr. Grossman.
Well, when I came in, I had a problem. I had broken a tooth. I was in a lot of pain, and I found Doctor, and you could tell from his personality, it's really hard to want to go anywhere else once you meet him. So, he's done all my work, and I've been really happy with it. I don't know if I'd ever go anywhere else now.
Geez, thanks, Amber.
I'm not lying, Doctor. You really are.
So when you first came in because you had one broken?
I had one broken in the front, and I was in a ton of pain. So I called around to see who would work with my insurance. I didn't have a whole lot of options, but I came here first, and I didn't go anywhere else after. So that's been it.
So what did you have done from there?
I have my whole body. Do you want to explain it?
We only did her bottom teeth so far. She had a broken tooth. She had decay in some other teeth, and we used a material called zirconia, layered with an Emax porcelain, which is the newer type of porcelain work for crowns and bridges. And what we achieved, and when you show the before and afters, you'll see that the margins go down right to the gum line. Everything looks healthy. You'll see that there was some decay and fractured teeth before, and open margins, and where bacteria can get into. And we restored her whole bottom jaw so that she can now feel comfortable and chew without pain, and not be self-conscious. And in a few weeks, we're going to be doing her upper teeth. We started on the lower just because she was, those were the teeth that were fractured and missing, and she was in pain on the bottom. The top is going to be a very nice cosmetic procedure when it's all done, and it will match exactly, and she has beautiful teeth now. She'll be even more beautiful.
Thank you.
Well, doctor, how long did that take from the beginning when she came with the broken tooth to, like, what's the process after that?
Well, you know, when first of all, you come in, you have a general radiographic examination and a comprehensive initial oral examination. And we list their problems and what we think we can do for them cosmetically and for the health of the mouth. And I think we put you in the following appointment. We went right to remove all her old prosthetics that were in there, and took out a tooth and put her in a cosmetic bridge right from the start, which took a few hours that day. And then we wait for her to heal, but she is wearing a temporary prosthesis, temporary crowns, temporary bridges.
So she was never toothless?
No, she came into it, she was, and with the following appointment, she was not. But we still weren't done when we did that. And then we waited till she healed about a month, and then we took everything off the temporary bridges. We picked colors, and I measured everything that would be conducive to her oral, her bite, and her what we call occlusion. Trying to keep it simple. But certainly we measured everything, we picked out colors, and then we fit everything a couple weeks later. And what the advantage coming here also, hopefully, is to have me do it, but also because we have a lab called Smile Renovation Lab here, and they do it, and we can change colors. We can work with our lab, and it's not the only lab we use, but it's
Well, he came into my appointment several times.
Right, the owner of the lab comes in, and it's great.
Amazing.
It is so important to work hand in hand with a good laboratory, because it's a team effort. It's not only me, it's my assistants, it's the front desk, it's the comfort level that they have, and it's also the laboratory that we use.
Well, you have fit and color, and the color that you mentioned is so important, because I've seen people who have veneers, and sometimes they're just so white, they're like in your face and shocking, and they almost look like big dentures that maybe don't look right. But the color, do you match that to the patient's other teeth? Do you match it to their complexion? Does the person who makes the teeth, do they give recommendation for it? And so what's the guideline?
You know, it's funny, you mentioned everything. You have to take in account their skin color, their hair color, their just, you know, what they want, what the patient wants. Sometimes, you know, patients want toilet bowl white porcelain, and certainly we have to talk them out of it. But, you know, we give what a patient wants, but we also give our advice as to what the color should be. But it has to work, you know, it has to match other teeth if they have other teeth existing, and certainly it has to be lifelike, and it certainly can't look like it is a prosthesis. You want it to look very natural.
Now, Amber, most importantly, how has this changed your life, your lifestyle? Because I know when I came in, I saw your before, and you looked like you were in a lot of pain.
I mean, I was in pain, but even before I broke anything, I'd worry about my smile and how I talk, and it's something I don't even think about anymore. And you were really concerned before I left the other day of how I felt, if the top was matching the bottom, and I just said, we're getting it done in 2 weeks, don't worry. But he's concerned about how I look, how I feel more than I was. So it's nice to have somebody that's really looking out for you. You know what I mean? Because I just want to get healthy and have them feel good and look good. But he's matching the colors and thinking about the things that I'm not going to think about till I'm at home later. Do you know what I mean? So it was nice to have somebody taking care of me that I could trust.
So someone maybe watching this show and maybe they're embarrassed or they have some, problems with their teeth. What are some recommendations you have for them, some advice as far as taking that first step?
My biggest thing was I was scared, and like you said, would I leave and have still a hole or have something missing and I'd have to wait 2 weeks or so? And I mean, I came in with all these issues and I left and I felt like a new person. Everything was straight, nice, one color, and I didn't have to wait at all. I was only here a couple hours, so that was so important to be able to leave and feel good again within 3 hours.
And pain-free.
And pain-free. Even that. I would have taken some pain. I had no pain either. I felt like a different person. I really did.
And how about with eating? Does it feel the same when you're eating and brushing your teeth? Is it the same care, doctor?
Yeah, well, you certainly want to take care of anything you have done. And, that involves flossing and keeping your appointments with the dentist for your routine hygiene cleanings and making sure that at home they're doing their part and flossing and whatever is necessary to keep it healthy.
I'm going to bring up 2 things. Caffeine or coffee and smoking. So are those 2 big no-nos or
Well,
what?
smoking is definitely a no-no.
Yeah.
You can't avoid coffee and certainly can't
can't
avoid
avoid
red
coffee.
wine, coffee or caffeinated products. But these newer porcelains, they don't get stained as our natural teeth do. So yeah, could there be topical issues with caffeine and red wine? Yes. But for the most part, these newer porcelains don't, the stain just doesn't occur on them to the degree that it would on older porcelains, older crowns from years and years back.
All right, I have the big question now. 9 out of 10 dentists recommend this toothpaste. Which one is it?
Well, to be quite honest with you, it doesn't matter what brand. You just have to be happy with the flavor. It's not what you use to brush with, it's how you brush. Okay. A soft nylon bristled brushes, and you have to angle your bristles at a 45-degree angle, and you have to go slow. And we do recommend, water picks, sonic cares are these new ultrasonic toothbrushes that work wonders. There's so many adjuncts that you can use to keep your teeth healthy, but it really doesn't matter. You can use Crest, Colgate,
Generic.
So what should it have? What should the toothpaste have in it, though? Should there be
Very good.
fluoride? Should it be whitening? Should it be for sensitive gums? I mean, whatever.
Well,
it fits
certainly,
the bill.
if you have sensitive teeth, there are sensitive toothpaste out there that contain what's called potassium nitrate, 5%, and it does help with sensitivity. But for the most part, you want to make sure you have fluoride in your toothpaste. Okay. Fluoride helps remineralize your enamel to prevent its breakdown, and it does work. Fluoride is so important, and I think in Hazleton they have fluoride in the water supply. Down in Wyoming Valley, Wilkes-Barre, we do not. So it's very important that we prescribe supplements to our children that are in this practice, fluoride tablets, because we do not have fluoride in our water supply.
What about whitening toothpaste? Is that good or bad
Well,
for your
there are
teeth?
whitening. No, it's not bad for you, but it's more marketing than anything. Brushing, flossing, and especially after meals is the most important thing you can do for your oral health. But I have a little saying, only floss the teeth you want to keep.
Well, thank you so much for coming on the program. I know we're going to be doing much more with you and learning about other procedures that you do here in the office. You are active on Facebook. You have a phone number that they can call, and they can stop in to see
And
you.
I want to thank you guys. I mean, not only were you were great here, you're very professional, you've got a great team behind you, and you have the most beautiful teeth I've ever seen.
There you go.
Thank you.
Thank you,
You're so
Doctor.
nice.
Thank you, Amber.
We thank you, Amber,
Thank
too.
you.
Oh,
I really
my pleasure.
appreciate it. Thank you.
Looking forward to our next appointment.
I was just saying, I'm
so-
looking forward to see that full smile I
too.
could see already
Me
with her
too.
beautiful lips. She has a beautiful smile. So, as always, the girls are going to bid you farewell right now, but you could watch us anytime click on our app, and we'll see you next time, because you never know you're going to see our smiles.